Welcome back to the Island Docs. And moving on, we have our specialist guest today who's about to give us some more information about hypertension. All right, Dr. Mohammed, tell us a bit about hypertension and some of the risk factors and some of the complications of the disease.
Okay, so hypertension is essentially high blood pressure inside your vessels. When you look at someone tells you what your blood pressure, there's a top number and there's a bottom number. The top number is your systolic blood pressure, which essentially is what happens when the heart contracts and what the pressure in your vessels is. And the bottom number is your diastolic pressure, and that's the one that happens when your blood pressure is when your heart's not contracting and just in your blood vessels. So a high blood pressure, according to the American Heart Association, is classified as anybody who has a pressure on the top that's over 140 and the one on the bottom that's over 90. So that's considered as high blood pressure. There's stages to high blood pressure. There's pre-high blood pressure, which is anybody from 120 to 140 and on the top number, and 80 to 90 at the bottom number. A hypertensive emergency can happen when patients come in with a high blood pressure such as 180 or over 110. In those cases, they have to be admitted to our ICU and be taken care of to bring their blood pressure down because they could instantly die from heart attack, stroke, or anything else when their blood pressure is that high. So unfortunately, we are in a population, we as a people are part of this group that has the highest risk for high blood pressure. African Americans, Afro-Caribbean, anybody of African descent, Latino, are nearly 50% likely to have high blood pressure, close to 50%. We are less educated about our high blood pressure. So with high blood pressure, there's some other additional risk factors. Men have a high propensity for developing high blood pressure, especially early on in life. By the time they get to 45 or so, the difference disappears between men and women. There's other things. Anybody who's obese are #1 known to be having high blood pressure. Anybody who has a decrease in exercise activity, anybody who has a high salt content, anybody who eats processed food, unhealthy food, anybody who drinks a lot of alcohol, all of these patients or all these people are prone to developing high blood pressure.
Now, I mean, we're in the Caribbean, there are a lot of people who, like you said, they have high blood pressure and they know about it and they ignore it, or they just really don't know. I mean, tell us some of the dangers of having high blood pressure if you know it goes on for years and you just ignore it, or you just don't know.
Yeah, so high blood pressure has no symptoms. It's called the silent killer for a reason. You literally don't feel any symptoms at all. The only time you feel a symptom is when you're in this state of hypertensive emergency where you have this headache and confusion and you feel like your heart's beating and you have chest pain. But that's only times that they have symptoms. Usually patients don't feel a thing. The way I like to tell people the issues of high blood pressure is this. Imagine trying to have your blood pressure, your blood vessels in your heart, maintain a high pressure where the inside of the vessels get killed off or slushed off or damaged. What that does, it allows that area of damage to be healed by your body. As your body heals it, those areas of blood vessel damage get smaller and smaller and smaller, allowing less and less blood supply. When there's less and less blood supply, there's two places that the blood supply is very crucial. To your brain. So 83% of the strokes that happen to your brain, they're ischemic strokes. That means blood supply has been cut off from high blood pressure. 13% are called hemorrhagic, or they bleed into the head because the blood vessels, the pressure has worn out the vessels on the inside and it pops and you literally just bleed into your head. In my ICU, just for the past 1 month ago, I've had two 40-year-old patients die from high blood pressure. 40 years old. Okay. 40, 42 and 46. They were sitting at home, having no problems, been told they had high blood pressure, did not take any medications, did not follow up. Now they're in 6 feet underground.
Oh, wow.
Yeah, so it's a silent killer for that reason. The other issue, it causes heart disease in the sense that the same issue about the narrowing of the blood vessels also occurs in your heart. Was your heart blood vessels narrow, you have a heart attack. It can affect your kidneys. It can cause what is called kidney disease. When you have kidney disease, you can end up on dialysis. When you have on dialysis, it's a long, complicated problem. And I see a lot of our Afro-descent, Afro-Caribbean people end up on dialysis from high blood pressure because of this. Stroke, impotence, for all the men out there, if you don't control your blood pressure, what it'll lead eventually is damage to the blood vessels in that allow you to form erections and have actually generate them. So if you don't control your blood pressures, you lose one of your favorite activities.
Oh my God.
For most women, they generally think just because they're women, they generally don't prone to hypertension, but they are. They are just as much risk by the time they get older as men to have high blood pressure and heart attack. Women have silent symptoms when it comes to heart attacks. They're not the same like the men where they have the chest pain, but in women, they actually die from heart attacks a lot more frequently than men do because of the high blood pressure.
Okay, wow. I mean, so in the Caribbean, I know a lot of one of my patients are hypertensive, and then they have to take medication. They don't like the fact that they have to take this medication for life.
Yes.
And they always complain about, yo, dog, this medication is giving me a side effect, whether it's real or imagined. And instead of coming to talk to you about it, they will stop taking that medication.
Okay.
What is your experience in dealing, or how should I approach those type of patients?
So to control your high blood pressure, there's several things you could do. One of the first things you could do is try to do lifestyle modifications. And this is cutting out the salt from your diet. This is improving your exercising. In fact, if you lose weight, you can improve your blood pressure. If you lose 10 kilograms of weight, you can lose blood pressure by 20 points. You could decrease it by that much.
Okay.
If you exercise regularly 30 minutes every day, decrease your salt intake, eat healthy, live better life, decrease in alcohol, you live better. If you don't take your medications, let me put it to you this way. It's whether you lose your heart, you stroke, you lose your kidneys, or you die suddenly from high blood pressure. If you don't take your medications, all these things are going to most likely happen to you. It's almost a guarantee with high blood pressure if it's not controlled. And when you do control your high blood pressure, you reduce your chances of having any of these bad adverse effects happen to you. The way I tell patients is, do you want to die earlier or do you want to live longer by taking your medications? If you want to die earlier, fine. It's up to you.
Okay. All right. So I just want to give a very special thank you for Dr. Mohamed for being here.
Thank you.